Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going.
Karibu Topil Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Topil Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Topil Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Topil Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.topilhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@topilhospital.com. Topil Hospital, exceptional technology, extraordinary care.
31st day of May 2023. My name is MC Kalia. This is the Morning Glory Show. It is the most comprehensive talk show in Kenya today. And this particular morning, being a Wednesday, then it is the Healthy, Wealthy, Wise Wednesday. And with us this particular morning is Nyamisi or Nyasimi from Tofil Hospital. And also we have with us Faith, an Iserian, who is actually a patient, or rather she's a survivor because she's already well and about. So before we go into the details of what we are discussing this particular morning, allow me to remind you that we are coming live from Dawi Afrique Photography. It is a production house based in Eldoret, Zion Mall. Anytime you have anything that goes into video and photo production, consider working with us. We not only give you a good experience in front of the camera, but then we also make sure that you get some well-documented work at the end of the rope. So make sure that if you have a wedding, a funeral, if you need to get some nice family portraits, consider working with Dawi Afrique Photography. Then we also have a Safaris branch, and this June, of course, tomorrow will be June. So on the 17th and 18th day of June, we shall be camping at Rimoi. Rimoi is in the Elgeyo Marakwet County. If you want to see the biggest elephants, then you need to visit Rimoi. If you need to see some magical scenery, then you must be there. In addition, we shall be having fun and games. We shall be having team building activities, all to just make sure that you rejuvenate and that you forget the problems that the first part of the month, or rather the first part of the year, okay? January to June, then you rest, unalamba glucose, then we start again from July tunaipiga mpaka December. Anyway, of course, also as we continue, then I want to remind you about D-Square. You need to dress to be addressed, and the only place where you can get some nice dressing, or rather where you can dress to be addressed, is D-Square Fashion House. Now, D-Square right now is also giving you an opportunity to learn to dress to be addressed. What does that mean? They now have a school called D-Square School of Fashion Design and Tailoring. This is for those who want to take up fashion as a career, because right now, or if there's an industry that we don't expect that it will be depleted anytime soon, is fashion. We are not planning to go back to the Garden of Eden. So please make sure that you visit this Square School of Fashion Design and Tailoring. Once you're there, make sure that you ask that you be taken also to the fashion house, so that when you're learning, you also have the experience of being in the fashion house and learning from those who've already been practicing this. Now, 45 minutes past the hour, 7 in the AM. As I told you earlier, we have with us a physiotherapist from Tofil Hospital and Nigerian. So Nigerian had a back problem that was causing her a lot of pain and numbness in both of her feet. And she happened to have visited Tofil Hospital at that time. And she was taken in for surgery, and she's just here to share her story with us for the purpose of giving hope and inspiring those who may be going through conditions of the back. So this particular opportunity, I would love to give Faith a chance to introduce herself and tell us a little bit about her condition. Karibu.
Okay, thank you. My name is Faith Naserian Teleo. I'm an administration police officer from Soi Sub-County. So, nilipata back pain since October 2021, whereby I was at work and then I fall. Nikapata hiyo shida ya mgongo. So, wakati huo siku notice kama ni back pain ama spine imeharibika at that extent. So I had to take some painkillers from the chemist. I took some painkillers for 2 weeks. After that, the pain persists. So I had to go to the hospital. I visited another hospital. So they gave me some medicine. Kanipatia medicine. And then wakaniambia to attend physiotherapy. So I attended physiotherapy in September, October, November, and then December, there was a colleague who told me about Top Hill Hospital, whereby aliniambia Top Hill iko na neurosurgeon mzuri, so I can try there. So nikaenda hapo tarehe 16 December 2021, whereby nikadirectiwa kwanza kwa physiotherapy. Nikaenda huko kwa physiotherapy at that time. So kwenda hapo nilipopata physiotherapist hapo akaniuliza umetry kufanywa MRI. So akaniambia you can try ufanywe kwanza MRI and then tujue the cause ya hiyo back pain. So I went hapo nikafanywa MRI. After that nikaambiwa nipeleke results kwa neurosurgeon FKH wa Top Hill Hospital. So nilipomwona akaniambia back yangu imeachana, that is the spine. So akaniambia hii condition yangu haiwezi saidika na any medication or what, so I have to nafaa nifanywe surgery. So wakabidi wakasema nifanywe surgery that evening because hiyo pain ilikuwa imepersist sana.
Labda nitakuinterrupt tu hapo kwa surgery, tuanzie hapo. Of course, let's also give a chance to our physiotherapist to introduce himself and also tell us first of all a little bit about this particular case and how you received it, and there is how you ended up also opting to maybe send her for MRI.
Before I introduce myself, I want to thank you for having us today here. I'm Bernard Nyasimi, one of the resident physiotherapists at Top Hill Hospital. So as Faith has said, maybe after she had visited some facilities here and there, then she was referred to our hospital by her colleague, one of our colleagues who had undergone a surgery, back surgery before. So she came to our department. I remember that's where we first met. She was connected to me by her colleague who I was managing before. So when she came to me, she explained to me how she got the problem. She reported that she had fell down when she was at work. So, and when we look at one of the causes of back pain, or rather the red flags, we find out that once the patient or someone has fallen down, or rather had trauma, we don't just go direct and begin managing her. So we have to find out if there is any problem with the spine, or it is just the muscles, the sprain of the ligaments. That's why we referred her first to the doctor to try do an MRI and find out where the problem was exactly. So when she had done the MRI, we found out that Faith had a problem with the vertebra of the spine. She had a dislocation, or rather what we call subluxation. So that's why she needed an urgent surgery.
And of course, before we come back to Faith, maybe of course, in the past few weeks, we've been talking about the back quite a lot. And I remember one of the doctors telling us that by the time you are age 25, there's a possibility that 25% would have reported a back issue. By the time we are 45, then 2/3 of us would have reported such an issue. By the time you are 60, almost 90% of us would be having one or any other spine condition. Maybe what are some of the other causes of spine injuries, or rather spine disorders, apart from trauma?
Okay, thank you. Apart from maybe what you have said, age, with age as we grow, there's what we call aging of structures in our bodies, what we call physiological changes. So we can have a degeneration of discs. Once the disc has degenerated, then there is a tendency of the vertebrae rubbing each other, and that can be a cause of pain. Other things that might be causing low back pain can be disc herniations. It can be disc bulging. It can be degeneration of cartilages or other discs, as we have said. And other predisposing factors could be due to the nature of occupation, or rather the nature of work that we do. It can be structural changes that might occur to our spine. It can be due to diseases. It can be due to trauma. It can be due to sitting posture. All those factors sometimes predispose us to now getting those changes like disc bulging, disc degeneration, and rather the nerves now begin to be compressed.
Okay, thank you so much for that. And for those who are watching us at home, of course, if you have any questions to ask, this is the time to do so. So make sure that first of all, help me share the broadcast. And by the way, thank you for being with us this particular morning. I can see Juma David says, following you, Nyasimi. Noeline Maru says, nice show, I'm following. Thank you so much. Then we have Otieno Tito Titas says, Bernard Nyasimi, one of us, or rather one of our own. Thank you so much. Ambassador Alfred Sargent says he's following live all the way from Perth, Australia, or rather he loves to say Itigo Perth. Thank you so much for always making time to be with us, and thank you for always supporting the Morning Glory show. Of course, I can see more comments coming in. Of course, I'll make sure that I sample some of them or most of them, but then more specifically, if you have any questions related to spine injuries, related to physiotherapy for that matter, then make sure that you do send them to me. I'll be able to read them and also give a chance to Nyasimi to answer them. Now, coming back to you, Faith, let's talk about now, before we go to the surgery, let's talk about the symptoms. Ulikuwa unahisi aje? Na labda ilichukua muda gani baada ya wewe kuanguka ndio ka realize ni kama kuna kitu iko haiendi vizuri? Alafu what was going through your mind? Did you expect that it's something big or expected it's something minor, then you'd be fine?
Okay. So after kuanguka siku notice kwamba spine yangu ili dislocate. Nilifikiria tu ni pain ya kawaida, so nika manage na medicines from the chemist. So nikakunywa dawa for 2 weeks, nikiendelea tu kwenda kazini. At that time imekuwa a lot of pain. So wakati mwingine nilipotoka tu kazi hivi jioni, nilipofika kwa nyumba nikasikia miguu ni kama haitaki kuenda tena. In fact niliinama tu kufungua viatu, nilipoinuka juu ni kama back haitaki kurudi juu. So I told my sister, hii mgongo ni inahitaji kuangaliwa. So nika Google about venye nina feel, manake nilikuwa nasikia miguu inachoma, mgongo inauma hapo chini, and then miguu inachoma. So nika Google how I'm feeling, and then ndo ikaniambia it might be a spine problem. So ndo nikaamua niende hospitali. So kwenda hospitali, sikufanywa MRI in another hospital, lakini walinipatia tu dawa za muscles na nerves, and then wakaniambia ni attend physiotherapy. So whereby nilipo attend bado siku feel vizuri, and then ndo nikapatana na huyo colleague akaniambia naweza try Top Hill Hospital, inakuanga nzuri kwa spine. So ndo nika attend huko.
Labda wakati uliambiwa now that you're supposed to go for surgery, ushaambiwa what went through your mind? Of course, we have so many people who feel like surgery kidogo kuna ile ulegevu. Labda wewe ulihisi vipi wakati uliambiwa basi hii sasa ni surgery?
So wakati nilipeleka hiyo results ya MRI kwa Daktari FKH, akaniambia hii ni mgongo wako imedislocate and then you have kufanywa surgery. At first ilinishtua sana kwa sababu sijawahi expect kufanywa surgery yoyote. So at first nilistuka sana, hata pressure ilipanda ya mwili at that time. So daktari ndo alianza kunipatia hope, hii kitu si mbaya, unaweza fanywa na bado urudi tu normal. So nilishtuka, honestly nilishtuka sana. Yeah.
Ulieleza familia, ulipigia nani, ama what was your initial reaction baada za kushtuka? Ukapigia nyumbani, ukafanya, because hii ni surgery ambayo ulifanywa within the same day. Watu wengi labda si kitu cha kawaida, manake kuna ule atasema wacha niende nifikirie, wacha labda msukumo wako labda kukubali kufanywa wakati huo ulitoka wapi?
So wakati daktari aliniambia hii mgongo yako inahitaji urgent surgery. So mi at first nikamwambia leo ama nitaenda nirudi. Akasema ikiwezekana inahitajika tuifanyie leo. And then kwa sababu ya a lot of pain yenye nilikuwa na feel at that moment, singekataa kufanywa that surgery. So nikamwambia nitamwambia after 1 hour. So I got out, nikaenda nikapigia my mom, nikamweleza now mom nafanywa surgery ya mgongo. My mom hakuamini at that time because alikuwa anashindwa hii surgery ni nini. Kwa kwetu watu hawajui mambo ya surgery. So akaniambia kama imefika hapo na then wanasema that is the only solution, we take heart, fanywa hiyo surgery, tutakuombea Mungu utakuwa sawa. So nikapata hiyo nguvu ya kufanya hiyo surgery. Yeah.
Thank you so much for that. Asante sana. And Nyasimi, now coming back to you, of course, let's now look at first of all the attitude of patients when they are told wanaenda surgery. Maybe what are some of the reactions you get at the hospital level, and what would you want to tell such people?
Oh, thank you. Okay. From what I've experienced and what I've seen, also from what I've heard from some of the clients like her, when she's told that she's going to undergo a back surgery, of course, she's surprised. Maybe to some clients, you find out that maybe that's the first time they are visiting an hospital for a serious case like that. Or sometimes you find out that maybe she or he has not undergone any surgery before. So, of course, you can't find someone who is very positive about the surgery. But maybe due to the challenges that they are undergoing, let's say the back pain, let's say the numbness on the feet, and many challenges that they will be presenting with, you find out that there is no other option. They have to undergo surgery. So after they have communicated maybe to their relatives and maybe some other important people in their lives, they come up with the solution, or rather they come up with a decision of undergoing a back surgery. So the attitude is normally not that positive, but after they have interacted with the neurosurgeon, or rather the surgeon who is going to do that surgery, then they of course give in.
Thank you so much. And now Faith, wacha turejeleza katika ile wewe za kuingia kwenye surgery, and of course coming back now after the surgery, how are you feeling? Take us through your process ya pale hospitalini hadi wakati ulidischargiwa.
Okay. So after wameniambia watanifanyia hiyo surgery, so nikakubali, wakaniweka hospitali hapo. So I remember it was at 10 usiku ndo nikafanywa hiyo surgery. Niliingia theater, so nikafanywa hiyo surgery. So after kufanywa hiyo surgery nikapelekwa hapo ICU kidogo for 24 hours, and then nikatoka hapo. So unajua sasa venye umefanywa hiyo surgery, you can't walk, hawezi jipendua, hawezi fanya anything by your own. So nikasaidiwa na nurses hapo, nikapelekwa ward, whereby nikakaa ward for around 7 days. So after 7 days, hapo nilikuwa tuna manage your pain, because there is a lot of pain after surgery. So nikamanage your pain for that 7 days, and then nikadischargiwa. Yeah.
And of course pale nyumbani, of course pia kazini, what were some of the changes that now you had undergone? Ukitoka hospitali, could you stand at that time?
Okay. After tu nimedischargiwa from the hospital at that time, at first singeweza jifanyia kitu, singeweza jipendua, singeweza hata kujipeleka msalani, singeweza kufanya anything. So I had kupata muda wa kupumzika na kurecover. So wakati nilitoka tu hospitali, immediately nilikaa for 1 day, and then tukaanza physiotherapy at that time. So singeweza kwenda hospitali kwa sababu ya condition ya back, singeweza kuenda na gari kwa sababu ya kurushwa. So physiotherapist wangu alijitolea, akakuwa anakuja nyumbani, tunafanya physio hapo nyumbani. So after 1 week hivi, nilipofanywa after 1 week haikurespond, so I was feeling a lot of pain bado, nikarudi tena hospitali. After kurudi hospitali, nikafanyiwa x-ray, waangalie kama zile, kuna chuma kidogo niliwekewa kwa mgongo, waangalie kama screws ziko kwa line yake. So after kuona ziko sawa, then wakanimanagea pain for 1 week, nikarudi nyumbani. So after kurudi nyumbani, tukaendelea na physiotherapies. We are doing it 4 days a week. Tukaenda tukapunguza, tukaanza kufanya 3 days a week. So nilikuwa nimeanza kufeel better. Although bado sikuwa naweza kuamka after 2 weeks, 3 weeks, kwa bado naweza kuamka. But I was feeling better, pain inaanza kupungua. So tukaendelea na physiotherapy mpaka wakati tulianza kufanya twice a week, whereby nilikuwa sasa na nguvu ya kwenda hospitali. Nilikuwa ninaenda sasa kufanyiwa physiotherapy huko hospitali, Top Hill Hospital. And then daktari wangu tena physiotherapist angeweza kukuja nyumbani kwa sababu kuna machines ambazo si portable, angeweza kubeba mpaka nyumbani, so I had to go to the hospital nikafanyiwe full physio. So huko nilikuwa na manage tu vizuri. I was doing physiotherapy for 1 hour hivyo, and then
Thank you so much for that. Of course, bado nitarejea kwako. Kwa wale ambao tunatazama kutoka nyumbani, help me share the broadcast. Let's have as many people watching. Of course, there is one person who is really a fan of Nyasimi, saying from Nyankekaroiro or something like that in the world. So there's only one Nyasimi. Anyway, so Nyasimi, now that your fans are watching, maybe you need to say hi to them. But then before that, tell us about now the physiotherapy technique that you had to employ for her. But then also, as before you take us there, maybe you can tell us first of all, what is the role of physiotherapy, especially in such kind of surgeries?
Okay, thank you. Our main aim, once a patient has undergone a spine surgery, majorly around 3 things. So the first one, we want to start early mobilization. Then number 2, we start ambulation. Then number 3, we teach exercise. All those things will help her during her recovery period. So if we delay starting the physiotherapy care, then of course she might develop other complications. So that's why we majorly start physiotherapy as early as that. So like for her case, we started physiotherapy from ICU. So the first thing we do from ICU, or rather what we call recovery unit, we start with we try to ambulate the patient. Tunamshikilia tu polepole kutoka from the ICU bed, kumsaidia kutembea kidogo kidogo. She can do maybe a few steps, like 10 steps, 20 steps, and go back. So we start from a low note. Even the exercise, we start them from a low note. As the days go on, then we start improving on what we do in terms of physiotherapy care. So once she has gone to the ward, we will continue with ambulation. We will teach how to turn in bed, how to position herself in bed. We will teach her the do's and the don'ts, what she can be able to do after the surgery and what she can't do maybe after the surgery, so that we avoid re-injuring herself or rather straining so much. So that's what we normally do.
Because in this case, maybe I'll still come back to you and ask for now the progress with Faith specifically. What were you trying to achieve, and take us through the milestones that you've seen as a physiotherapist since the time she was in ICU till now, maybe the time you stopped doing the physio?
Okay, thank you. Okay, for her case, as I have said, after we went to the ward, that's where we began ambulation with support, of course. After 2 to 3 days, still we could support her, but with minimal support. Then after like 5 days, she was able to go by herself, but of course not that okay. Then of course our gait wasn't that good, so we started training about the gait. We started teaching her some exercise that she can be doing to help keep the spine in shape. Then also, because of the muscle spasms, or rather the pain that is normally at the back after the surgery, we could do slight massage at the hospital. So after she went home, we started again physiotherapy. We introduced some of the modalities that could help her. There are some modalities that you can use after surgery and immediately after surgery, and there are others that you use maybe thereafter. So when she went home, she was not staying far away, or rather she was just within. So because one of the things that we don't want the patient to do after surgery is traveling a long distance, or rather traveling for more than 30 minutes, not driving, and many more. So I could go to a house. We do some physiotherapy from there. One of the modalities that I was using that time was a TENS machine. So after the TENS machine, we do some slight massage introduce some heat to that area. Then we do back exercises, what we call beginner back exercises. So from there, at that time, we were doing it every day. So after like 7 days, the pain was still there, and then she was not getting better kidogo. So I advised her, let's go back to the doctor, the neurosurgeon, and maybe we find out that we find out if there is a problem with the instrument that was put on the back, or if there is any other issue. So when she went there, the doctor recommended an X-ray. An X-ray was done, and then we found out that the instrument that was placed at the back was intact. Everything was okay. It was purely muscles. So the doctor said she should stay there for a few days, for maybe to maximize on pain management. So after a few days, she went back home. After she went back home again, we began again physiotherapy. At that time, we were doing it 4 times a week, at least, as in we skip a day, we do it again. At that time, she was really improving. She was getting better. Then we graduated to 3 times a week, 2 times a week. After like a month, she was almost okay. So I advised her, there are some modalities that, or other equipment that we use at the facility to try strengthen the back muscles. And those ones we can't carry them to a place. So that's when she started now coming to our facility. We continued the management from that end. So after like 3 months, she was okay. She was doing good. Now that we didn't want her to go to work immediately because of maybe some flexibility issues. So after like 4 months, she was now okay, very flexible. Then she decided to go back to work. So up to this moment, she has never complained of any pain. But what we normally encourage her is maybe once in a while she can visit our department to try maybe do some relaxation of the muscles, maybe after long standing, because majorly our work is standing at work. So to try relax the muscles.
Okay, of course, we'll still come back to now how much that can go into the nature of work, how much it can go into affecting our spine and what we need to do. But then before we come to that, Nigerian, let's now talk about the changes that you have undergone maybe since that time when you started physio. What are some of the things that have changed in your life, and if you've really gone back to what you used to do before the injury?
Okay. So after that surgery and physiotherapy, I can say now I'm okay, but I can't do, siwezi fanya hizo kazi ngumu. Hizo kazi ngumu siwezi fanya vile nilikuwa naweza maybe kujibebea 20 liters ya maji. I can carry it, but naweza fanya kazi zingine zote za normal person, naweza bend, lakini sio kwa muda mrefu. Naweza jog, I can even run. I can do normal duties, but nikio ninajiangalia zaidi. Yeah.
And labda, what are some of the challenges that you went through during the recovery process? Labda kwa wakati moja ulihisi, what were the challenges?
Okay, after your surgery, you know, now kama kutembea, singeweza kutembea vile nilikuwa ninatembea. So ili take process ndo nianze kufunzwa kutembea. Unaanza kufunzwa kama mtoto mdogo na unaambiwa usiende hii side ya left, tembea straight. Unafunzwa na physiotherapy. So nilikuwa na feel kwani mgongo wangu itairudi tena, nirudi normal kama vile nilikuwa. So nilikuwa napata hopes from the physiotherapist, ananiambia ukiendelea kufuata vile ninakwambia, ita take some few 3 months utakuwa sawa. At first sikuwa nakubaliana na physiotherapist kwa sababu nilikuwa naona isioni kama nitarudi normal, but after around 2 months nilikuwa naweza enda kutembea kidogo, kutembea nikikuwa coach venye nitatembea, and then nisibend, nitembee straight. After 3 months nikaona kuna changes. I can walk, lakini sio fast. Yeah. So I can say changes zilikuwa kwa mwili kama hiyo kutembea, uwezi jiamsha peke yako, uwezi jiamsha, lazima uamshwe na mtu. Aya, uwezi hata kupanguzwa maybe hivyo. Yeah.
Okay, asante sana. And by the way, you sharing your story goes a long way to encourage those who may be going through such conditions and do not, maybe are still skeptical about going for surgery. The reason why we are doing this, dear viewer, is to just make sure that if there is someone who is going through such a condition, if there's someone who has been told you're supposed to go for a back surgery, not only at Top Hill Hospital, but then any other place, then they may also get hope and encouragement that actually it is possible to, in the current world and technology, that it is possible for you to walk into a facility and get yourself checked and make sure that you're okay. Another thing that we've insisted quite so much on the show is that anytime you feel you have a problem with any part of the body, do not just maybe enter to a chemist or something like that. Make sure that you actually see, or rather you make sure that you go into a hospital. Now, coming back to you, Nyasimi, let's now talk about, of course, now this was an injury. Let's talk about the nature of works that we do. And of course, talk about how that may affect our spine. Maybe if it is sitting down so much, how much does it affect? If it is, take us through the whole, how you would advise someone according to the nature of work, generally.
Okay, thank you. One of the major things that cause issues to our back, it can be the nature of work, as you have said, the nature of work that we do. You know, what we encourage us is to obey good ergonomics. So if you don't obey good ergonomics in your work environment, then you are going to develop some of these back issues. For example, someone who works in an office, if you don't sit properly on the chair, or rather the seat that you use in the office, then you are going to start affecting your spine slowly without you knowing. So what we encourage us is you make sure you sit properly on that seat. Then for those who stand for long, or rather who do a lot of work while standing, we encourage them to maybe you take a short break, at least you move about, so that you relieve all that pressure that is put on the spine. Again, also it's the same case for those who sit in an office. If you sit, for example, between 45 minutes to 1 hour, then you take a 60 to 90 seconds break. That one relieves a lot of pressure from your spine at the lower back. Then for those who do a lot of work lifting objects, or rather heavy objects, we make sure that we employ proper techniques while lifting those objects. You make sure when you pick something from the floor all the way to your shoulder, or rather to the head, you make sure that you work your upper limb muscles and lower limb muscles so that you don't strain your back muscles. All we encourage is you make sure you don't use your back muscles. You make sure you use your hand muscles and the leg muscles. With that, you are going to protect your spine. So all these nature of works, what we normally encourage people is that make sure you obey good ergonomics. So if you don't know what to do, just visit us at Top Hill Hospital, or rather any other physiotherapist. He or she will be able to teach you the proper ergonomics in that working environment that you normally do your work. Yeah.
Of course, and a question just to join to that, borrowing from Faith's story, what are some of the quote-unquote red flags that if nikisikia, then it means that I really need to go to a hospital? Then also, what are some of the common mistakes that many people do when they get such pains?
Okay, thank you. Some of the red flags for you to maybe to visit a doctor. When you come to us, the first thing you complain of is severe pain. A pain that when you lie down, when you try maybe flexing your back, the pain is not going away. So that's one of the red flags about low back pain. Another one is numbness on the feet. So if you come to us, you have numbness on the feet, that's another red flag. So again, if you have maybe any weakness on the lower limbs, that's another red flag. Another thing is maybe you come to us and then you give us a history of a fall, whether you had an accident, you had trauma, maybe something hit you on the back, then you present with all those other maybe symptoms, then what we normally do, we don't attend to you. What we do is we refer you to the doctor. So once you go to the doctor, what you're going to do there is just investigation. So when you go to the doctor, depending on your story, yeye ndiye atachagua what you will do. If it is an MRI, an X-ray, a CT scan, what chenye atakwambia ufanye. So once you have done the MRI, then the doctor, or rather the neurosurgeon or the doctor that is around, will want to know the structure of your spine. Is there any problem with the spine? Is there any problem with your muscles? Is there any problem with maybe discs? That's what the doctor wants to find out. So once I may study the MRI and finds out that the issue is maybe with the muscles, then atakutuma back to us. So for muscles, we can manage with physiotherapy na kila kitu inakuwa sawa. But if the problem is with the disc or maybe the bones of the spine, then hapo ataku advise on what to do, maybe a surgery to try sort out the problem. Because you can't run away from this problem. If, for example, it's a dislocation at the back, the more you continue doing work, the more you continue straining, still the pain is there. The bone, or rather the vertebra of the spine, will continue now impinging the nerves. Then with that, the pain itaendelea kugrow pole pole. Then you might develop other diseases that zinakusumbua for quite a while in your life. So that's what we normally do after tumepata mahali shida iko. Then what the mistakes that patients normally make, maybe wakati mtu amepitia a problem like that, ameanguka chini, or rather there's an issue with the back, they normally don't go direct to the facility to try ascertain the cause of their pain after maybe they had a fall or rather any challenge. You find someone going to a chemist, maybe ananunua dawa, maybe some pain meds. With the time, she's not getting better, ama wakati mwingine she gets some relief, then after some time that thing again reoccurs again. So some of them present with poor health seeking behavior. If you go direct to the facility after you have fallen down, like for her case, if you go direct to the hospital, the doctor is able to find out the problem mali hiko. Before you start any management, unapata daktari kwanza, ana find out mali shida iko, then unaanza management. Yeah.
So much for that. Of course, I can't get tired reiterating that, because it's something that we talk about almost every week, that when you suspect something, then the right place to go is a hospital. Now, coming back to you, Faith Nyserian, of course, there's somebody right now who's watching and have a problem, or know someone who has such a problem, and they are asking themselves, how do I go about it? Getting it. Kuna mtu mwenye akona uoga, ameambiwa aende surgery, akona uoga. Kuna mtu akona anasikia pain saa hizi na akona wasiwasi. Talk to that person.
Okay, Kenya, mimi naweza waambia hizi vitu fanyika, na surgery sio mwisho wa maisha, na sio mwisho wa kuishi. So ukielezwa na daktari unahitajika kufanya hiyo surgery, ni kitu inaweza fanyika na ikuwe successful, kama vile mimi nilivyofanyiwa. Nilipofanyiwa hiyo spine, at first nilikuwa nafikiria sitakuwa sawa, but then sasa niko sawa. Can say si kitu mbaya vile watu wanaiweka. Wengine wanasema ukifanywa surgery unakuwa mlemavu. Mimi naweza sema hiyo si sawa, kwa sababu mimi nimefanyiwa hiyo surgery, nimewekewa hizo chuma, na as for now I can walk, I can do my normal duties. Nimerudi kazi, najifanyia kazi kama kawaida. So hizi vitu ni kawaida, na kwa sababu kama binadamu hatuwezi avoid, then ikikuhapenia, take heart, ukuwe na hope, na uende hiyo medication, uende matibabu kutoka kwa daktari. In case of a surgery, usiogope, nenda, ukifanyiwa utakuwa sawa. Kuna possibility ukifanyiwa surgery unaweza rudi back to a normal you. Kama vile mimi sasa nipo, hata mtu hawezi jua kama nimefanyiwa surgery. Nikisimama hivi mtu hawezi jua nimefanyiwa surgery unless nimwambie. So it's ni kitu inafanyika na unarudi kuwa sawa.
Kiakili tu pia kule kwa stable kiakili ilichangia kiasi kipi kwa wewe kuweza kupona? Pia unajua mambo mara nyingi pia kiakili. It take us all through the mental journey. Was it for you wakati ukirejea hospitali and all that? Hebu manake pia kuna ule ashafanywa na yuko katika hiyo stage.
So mi kwanza kitu naweza ambia watu ukishafanywa hiyo surgery ama kabla hujafanywa, ukielezwa kwamba unaenda for surgery, ni jambo ambalo watu waichukulia kwa uzuri. Kama vile pia mimi sikuichukulia kwa uzuri, and then ili happen mpaka ikanipandishia blood pressure, nikakuwa sasa niko na high blood pressure. So ni kitu ambayo ina traumatize, inakupatia mawazo, inakusumbua kiakili. Lakini ni kitu pia unaweza manage. And then kitu yenye ninaweza sema, at that time mtu anaweza fikiria sasa nikifanyiwa surgery sitaweza kutembea, nitabaki kwa wheelchair, nitarudi kweli normal? So ni kitu yenye inasumbua akili sana sana, kwa sababu ni kitu ambaye maybe at once haujawahi fikiria kufanyiwa, or else haujawahi pitia condition kama hiyo, ama hata kwa familia yenu hakuna mtu ameipitia condition kama hiyo. So mi Kenya naweza ambia mtu, kama ni first time umefanywa surgery ama umeelezwa utafanywa surgery, inaweza kusumbua kiakili, lakini ni kitu at long last ukichukulia positively. Uchukulie positively, usiweke kwa mawazo sana, kuwa na imani, kuwa na hopes ya kwamba hii kitu nimefanyiwa, one day, one time nitakuwa sawa, na ni kitu just a matter of time and then nitakuwa sawa. Unafaa tu kujipatia hopes.
Shukran sana Faith kwa hayo, na tukiwa tunaelekea sehemu za mwisho ya interview ya siku ya leo, nitarejea kwa kwenye simu. So let's now talk about the common mistakes that people do post surgery, especially during the physio process and in terms of adhering to the programs that you've prescribed as a physiotherapist.
Let's say one of the common mistakes, or rather the mistakes that patients do after surgery, is one, when you go home and stop following the program that we give you as physiotherapists. So if you go home, you don't obey all those don'ts that we taught you, then recovery might also take time, and maybe some other complications might set in. So if we prescribe for you a program and tell you we want you to do it maybe 3 times a week or 4 times a week, you make sure you adhere to that. So if you don't adhere to that, then there will be a lot of changes to your spine. The muscles might be tight. You might maybe dislocate or rather interfere with that thing that maybe was placed on your back. That's in case if you had an implant on your back. So again, another thing is if we tell you don't lift something heavy, then if you go on and lift, again, you're going to interfere with that surgery. Another thing we tell you is trying to mobilize or rather to ambulate at home. So ukienda nyumbani and maybe your work is just to stay in bed, then again, recovery again will take time. And maybe some other complications might set in. Then if we tell you don't bend, for example, for like 1 month, then you make sure you don't bend. If we tell you to correct your gait while ambulating, then you do exactly that. So all those goals that we set in and agree with the client, if you follow them, or rather if you are there to them, then the recovery process inakuwa perfect. But if you don't follow it, then again, other complications might set in. You know, you can meet maybe with a certain client, maybe she did a surgery at a certain hospital, then maybe from there she or he was given instruction that Ukienda nyumbani usifanye physiotherapy, ama ukienda nyumbani anza tu kazi yako direct. That's them. But for us, if we tell you do this and this and this, then you go and then do it the way we have taught you, the outcome will be exactly as faith. Yeah, and then if you do the contrary again, we will just know. If you come to us complaining of a certain sign, we will know that there is something that you did wrong and we didn't teach you that way.
Same question that I asked Faith, or rather, like also that question actually, that there's somebody right now watching you. Maybe they've been told that they need to go for a surgery and they're reluctant about it. Maybe give an encouragement from a professional point of view.
Okay, thank you. If you came to our hospital or you went to a certain facility, then the surgeon told you that the only way out is a surgery. No, I will encourage you that just undergo that surgery. Everything will be fine. The main thing is, if you don't sort it as early as now, it will still disturb you in the coming future. So you make sure that if you have been told to do a surgery, you just do it. Again, if you follow those steps that we give you and plus the steps that the surgeon will give you, then the outcome is normally perfect. Don't seek maybe opinions from other people, more so those who have not undergone a surgery. Someone will come and tell you, ukifanywa surgery ya mgongo, then you won't walk, or utakuwa restrained kwa wheelchair, and many more discouragements. So you just decide it yourself, and maybe from someone who has undergone that surgery before. From the cases I've seen, since I've been there at Top Hill Hospital for more than 2 years now, all the surgeries I've seen, they are always successful. Recuperating back to normal life imekuwa tu kawaida. Where the difference comes in is the condition maybe from which I'm suffering from is different from the other person. So the other person might take a month to be okay. The other person will take 2 months. The other person will take 3 months. It depends with the severity of your problem. So your case won't be the same as the other one. If that person, maybe her case or his case took like 4 months, not necessarily that your case also will take the same period. So what I will encourage you is just undergo the surgery, follow the steps that you get, the outcome would be perfect.
So much for that. Sasa nitarejea kwako Faith, maybe your closing remarks, ile maneno yako ya mwisho sasa kwa wale ambao wanakutizama.
So ni kenye naweza sema ukiwa mgonjwa sio mwisho wa maisha, sio mwisho wa kuishi, na hizi conditions zinakuja na zinaenda. So mimi sahi naweza sema niko sawa, ndio nimeundergo hiyo surgery but I'm okay. So wewe hapo nje kama uko na shida the same kama yangu or else kubwa kushinda yangu na umeelezwa uende for surgery, ende hiyo surgery, fanyiwa, mambo ikienda vizuri na ufuate regulations zenye utaekewa na daktari na physiotherapist, utakuwa sawa, utaregelea normal duties kama mimi, utakuwa sawa. Hakuna kitu inashindikana as long as umefanyiwa kitu ambayo kinafaa na umeseek medication from a good hospital or a good facility na neurosurgeon mzuri, utakuwa sawa, utaregelea kazi zako za kawaida. So kuna matumaini ya kufanyiwa surgery na kurudi sawa. So usikufe moyo, kama uko pale nyumbani ama uko hospitali ndio unaenda kuendea hiyo surgery, take heart, ende hiyo surgery. Usisikilize mambo ya watu watakudiscourage, lakini wewe mwili ni yako, wewe ndio vile unasikia. So ende hiyo surgery, utakuwa sawa kama venye mimi niko sawa. Yeah.
Asante sana Faith, and thank you so much for accepting to share your story, because I'm sure it will go a long way to encourage those who are going through problems that may be similar to yours. Of course, before I give Nyasimi a chance to give his closing remarks, allow me to remind you that this is the Morning Glory Show. It is the most comprehensive talk show in Kenya today. And by the way, we are here from Monday to Friday just to make sure that we bring you edifying content. If you're watching us and you have not clicked the like button, please do click the like button. The link will also remain on the broadcast, so do share the link as much as possible. Let's have as many people as possible benefiting from this particular show. Also, just to also remind you is that on the 17th and 18th day of June, Dawi Africa Photography and Safaris have organized something special for you. You need to visit. You need to visit us or call us. You can reach us via our. You can visit us via our social media handles. You can mail us, of course, and make sure that you be part of us as we travel to Rimoi. Rimoi is where you get the biggest elephant, so you need to be there. To Tambe Rimoi, let's enjoy. There'll be camping activities and all that. As we also continue, allow me to remind you about D-Square. Now, this one is, of course, about your dressing. Make sure you dress to be addressed. That's the only way. That is actually their mantra, that you need to dress to be addressed. If you walk into the fashion house, you get some of the best suits, both for ladies and gentlemen. If you have an event that you need to be dressed well, then also consider walking into D-Square. They also give you a chance right now to train with them. If you need to take up fashion as a career, you want to be a fashionista, then make sure that you walk into D-Square School of Design and Tailoring. In conclusion, of course, I would say that let's give Nyasimi a chance to give his closing remarks from a professional point of view, so far as such cases are related, and also your general advice as a professional.
Yeah, thank you. What I would like to say is that we welcome you to Topil Hospital. And if you have any problem disturbing you, you have any spine issues, feel free to visit us at Topil Hospital. So in case you have any challenge, any issue, like any symptom that might be connected to the back, just feel free to visit us at Topil Hospital. We will ascertain the problem. We will handle it properly as professionals. You'll see the doctor that one of the best doctors in the region at advice, and then maybe you will find out he will find out where the issue is. Then from the physiotherapy department, I would like to welcome you there. If you have any issue, if you have undergone any surgery and you haven't maybe recovered fully, just visit us. We will design a proper program for you. We'll make sure that you get well as soon as possible and get back to your activities of daily living. And then the last thing I will encourage us is let's improve our health-seeking behavior. Whenever you have an issue, just visit a doctor. Let's avoid over-the-counter medications. Let's avoid herbal medications. Let's visit professionals, then your problem is sorted. If you manage it earlier, then recovery also is faster. Yeah. Maybe the last quote I would like to leave us with is, from the physiotherapy point of view, doctors save lives, but as a physiotherapist, we make it worth living.
Life worth living. That is Bernard Nyasimi from Topil Hospital. Thank you so much for creating time to be with us. And also to my viewers, thank you so much for getting time to watch the show. Thank you so much for choosing Morning Glory Show. Of course, this is the show that you watch using your bundles. And we do not take it for granted that you buy your bundles. Again, watch us from the start to the end. Appreciate that. And we do not take it for granted. Thank you so much, Faith, for sharing your story. As I said earlier, it goes a long way to encourage those who could be going through such conditions. Topil Hospital is situated in Elgonview, just adjacent to Boma Inn. Anytime you have anyone or you is yourself who needs care, especially with spine and brain conditions, then consider it to be your number one run to hospital. It is in a serene environment, quite accessible. So make sure that you visit them and also visit their social media hand. Siku hizi kuna watu wanapiganga wanasema hospitali ya Glory, so you can still call us and we'd be able to direct you to Topil Hospital. So with that, thank you so much for being with us, and on behalf of everyone who made this particular broadcast a success, thank you so so much, and let's see you tomorrow on the social school.
Karibu Topil Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies.